whatever that may be. That could be sitting upright, could be laying on your back. And if you can find a spot that you can hang out comfortably. If you need to fidget, you can fidget, but try to find a spot where you can sort of be still. Now, there are moving meditations. I often count my walks as meditations. So I don't stick to a regimented, like it has to be sitting cross-legged. It could be laying in bed, could be seated. But get to a spot where you feel pretty comfortable. Take a big deep breath, and you could close your eyes. You don't need to see me for what we're doing here. And just notice where your breath goes in your body. See if you can follow your breath. So it comes in through your nose or your mouth, down into your lungs. Notice if your rib cage moves at all with your inhale and exhale. Notice if your belly is moving. So this first part, we're just gathering information, just noticing your breath, not trying to fix anything or make it into anything. Just a natural breath in and out. And sometimes what I'll do when I'm doing these on my own is count my breath. That's a nice way to give your brain something to do. So let's try counting. So I'm taking one breath in and out. Count your second breath, and I'll let you count these on your own because everybody's going to breathe at a different rate. I'm on my third breath. And if you lose count, you just start over, start back at one. And just notice how many breaths can you count in a row before your brain wanders off to start thinking about something else. And that's probably going to happen. So if that happens, just start back over at one. Counting your breaths in and out. So our goal here is just to pay attention to your breath, noticing it coming and going. And then can you let go of the counting of your breaths and bring your awareness back to your torso, your rib cage, your belly, your chest. And can you picture sort of a 3D balloon inside your ribs and your belly? And could that balloon really gently expand? So I'm thinking top of my balloon would be like my collarbones, shoulder blades, armpits. That's a spot we don't think about a lot. See if you can have some softness and expansion all around your chest, armpits, shoulders. What would that feel like to allow for some softness, expansion in that top third of your torso with each inhale? And then bring your awareness down a little bit lower to the sides, backs of your ribs. You might even rest your hands on your rib cage. Picture again that 3D expansion. Breathing in, allowing all the little crisscrossy muscles between each rib to soften. allowing your back to soften. And again, if your mind wanders, it's perfectly expected. And bring your awareness back to your breath. And then bring your awareness a little bit lower to your pelvis, your pelvic floor, your lower belly. You might even rest your hands on your low belly or your hips. And this time, as you inhale, can you allow your belly to be really soft and squishy? We often hold tension in our lower abdominal muscles. So there's no need to have a tight core right now. You can let everything be really soft. And I'll often picture the two halves of my pelvis widening with each inhale. My low back widening and softening. One more big deep breath, sending your breath all the way down to your pelvic floor, lower belly. And you picture sort of an egg shape from your torso. All three layers expanding your ribs, your upper third of your torso, your pelvis with each inhale. And then softening all the muscles in your torso with each exhale. And make this really easy. Easy breath in and out.